Do you suffer from knee pain? That's the big question. Is it limiting your mobility? Well, don't let knee pain prevent you from doing the activities you enjoy. Well, with us today to talk about help for aching knees is Dr. Stephen Bokshan with Cone Health Orthopedics at Drawbridge Parkway. Okay, we're going to get started right here. Besides a traumatic injury to the knee, what are the top causes for knee pain? Is it wear and tear of a joint over time or an injury that didn't heal on its own?
Yeah, that's a great question, Hunter. I think there are multiple causes of knee pain. By far and away, usually the most common an orthopedic surgeon will see is arthritis. Arthritis pain really comes across as we call it the Rice Krispie sign, where you might be noticing a snap, crackle, and pop. But the reality is there's a good number of a portion of injuries that aren't just from normal wear and tear. I'll hear it all the time where I'll have the patient come in and say, hey doc, a couple months ago my knee kind of popped and it felt weird for a little while, and I tried to walk it off, but that didn't really work too well. And then they come to see me, and lo and behold, it was usually an undiagnosed injury. So all the time I'll see patients that have kind of a distant injury of trying to walk off, maybe like a meniscal injury. And that's really when we'll make that diagnosis and we'll say, well, maybe it is a little bit of wear and tear, but actually it might have been something that happened a couple months ago, just out of the blue, doing something completely benign like raking leaves or something like that. We'll see it all the time.
I want you to give us an overview about what rice is again so people can remember what to do if they have knee pain at home.
Yeah, absolutely. So rice is a mnemonic that's near and dear to the orthopedic surgeon's heart. So RICE stands for rest, which means not being afraid to kick back and get that knee up in the air. Feel free to skip that one or two workouts if you need to. Ice, so applying a bag of ice or a frozen bag of peas. Compression, which can be just an over-the-counter sleeve or a gentle ace wrap. And then elevation, which specifically means getting that leg elevated up in the air, kind of above the level of their heart. Again, not being afraid to kind of lounge back. And then, of course, if safe and permitted by your primary care doc, some anti-inflammatories like ibuprofen can certainly go a very long way.
So with that being said, what are some things you should not do if you're experiencing knee pain?
Yeah, I think the don'ts are very important. I would say the biggest don't is do not ignore beyond a month. I think a month is a pretty safe time frame to say, hey, I think this is a little bit more than a sprain that I can just kind of walk off. I'd say the other don'ts are really ignoring the red flag kind of warning symptoms. For me specifically, red flag symptoms that I think should be checked out by a doctor, an orthopedist, would be a red, hot, swollen knee that's just not going away. It's very red, it's very inflamed. I think the other two are what we call instability. So not only having knee pain, but feeling like the knee is just persistently giving out, or it doesn't really feel stable during normal activity. I think the last one would just be mechanical symptoms. When I say mechanical symptoms, that could be something like a knee getting stuck. And hey, every time I bend my knee at this degree, it gets stuck and I can't straighten it quite all the way. I think those are pretty important symptoms, and something you might want to have your doc check out.
I think that's really good advice. Now, the other thing, a lot of people wrap their knees and put their knee in a sleeve when they're doing physical activity. Is that a good idea?
Yeah, I think with sleeves, kind of what I say is mileage may vary. I think if the reason that you're hoping to kind of apply a sleeve is to get that swelling out, by all means, I tell patients all the time, go ahead and put a knee sleeve on. I think it's really going to help you get your swelling down. I think it's important that you have realistic expectations of your knee sleeve. It is not going to magically kind of treat an internal issue. But that being said, if the goal is to reduce pain and swelling by getting a little bit of compression on it, I think it's a great idea. I think when you go check out knee sleeves, just keep in mind all knee sleeves are not built equal. So if there's one where the kneecap is quite sore, consider getting one where there might be a little knee cutout for the kneecap to be exposed. But I think it's really important. And if you have any questions, don't hesitate to consult your friendly orthopedic surgeon about which sleeve might be best for you.
Okay, so I'm not going to get rid of my knee sleeve just yet. I love that. All right, in some situations, injections or creams may be an option for knee pain. Are those some of the long-term solutions, or are there limits on how long somebody should use them?
Yeah, that's a really good question, Hunter. It's a question I get all the time. Injections, creams, they come in all different forms and sizes. When it comes to injectables, the most common things you're going to hear about are steroids or biologics. And I hope we get a chance to talk a little bit about biologics and PRP in a second. But when it comes to steroids, I think the indication is really important. I think when it comes down to it, oftentimes I'll talk with patients first about trialing an injection. I think it's really important as an option to have for patients to try and avoid surgery so they don't necessarily need to undergo, go under the knife and to optimize their function as much as they can. That being said, I think for a certain indication, you kind of get to the point where, hey, we've tried a couple injections. It's really not working as well as it used to. What are we doing? And I think at that point, it's just really important that you chat with your orthopedic surgeon. Hey, what are next steps? These injections are only lasting, used to last months. Now it's weeks and days if I'm lucky. I think at that point, you're really thinking about, hey, what's the next step?
And you also mentioned PRP. So what about regenerative stem cell therapy like PRP, and when should that be considered?
Yeah, that's an awesome question. So we really classify those injections. We call them biologics. The reason that we call them that is really because we're co-opting the body's own biology to bring a sense of healing to a knee joint. The reason that's really important compared to a steroid is that instead of breaking tissue down, we're actually building up and giving the healing response back to the body, we know that the body's already capable of. When it comes to the biologic injections, there's two big categories. One is stem cells and one is PRP, which stands for platelet-rich plasma. I personally use a lot of platelet-rich plasma. What you'll see with that is we literally draw blood off of your vein. We spit it down into the highest healing factors that your body can make and re-inject it into the knee. To me, it's really an amazing option for folks who steroids are no longer effective, who maybe have a milder form of arthritis. I mean, these are generally patients that come and see me and say, hey, doc, I'm not ready for a knee replacement. And that's when I say, well, the injections, the steroids aren't doing it anymore. Why don't we consider the PRP? Great evidence for PRP. I think having it in your toolbook is 100% necessary.
Okay, and then real quick, my last question for you. Some people put off calling a doctor, in this case, an orthopedic, so they tell themselves the pain's not that bad. How long should they go before they come in?
Well, one thing I will say is that I promise you we're not that scary. Oftentimes, just with consulting your orthopedic surgeon, I think at least anyways, I try and convince patients more than often, hey, let's try and stay away from surgery. So I think more often than not, you'd be surprised at how many times you're getting news of, hey, I think this will get better on its own or with a conservative treatment plan. I think a lot of it's just very up to the patient and their goals. I usually say a month for that cutoff time frame. Reason being is that if you have a tweak of the knee and you try to kind of walk it off, if it's going on for more than a month, I think it's worth an evaluation, and it's worth just, if nothing else, getting told by your orthopedic doc, hey, it's something that you will recover from, and it's
Yeah.
not something that's going to create any type of long-term damage.
Well, we appreciate you, Dr. B, for being here with us and giving us advice. We're going to have some links on our website, WFMYnews2.com, for more information if you're looking for it.